Thank you for joining us for this COVID-19 Telephone Town Hall weekly update, safely reopening our economy. We'll be taking as many questions from participants as we possibly can live on this event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. They'll take down your name and where you're calling from. The next time you hear your name, you will be live on the call and able to ask your question directly. Or you can send your question through the website if you're watching online. We're just beginning to dial out to households across Douglas County to invite participation, and we want to give folks a moment to join the call. My name is Dirk, and I'll be your host tonight. This is the 6th town hall that Douglas County has hosted since the start of the COVID-19 pandemic and the first in a series of weekly updates. We'd like to set the stage for tonight's discussion. Douglas County is currently following the state's Safer at Home order. We believe this will maximize public health while reducing stressors to the citizens and will enable businesses to slowly reopen to the public life and start resuming some level of normalcy. Now, we encourage everyone to continue demonstrating the public health recommendations found in these orders, including following social distancing guidelines, staying at home as much as possible, wearing non-medical cloth face coverings, and practicing abundant personal hygiene and cleanliness to keep our communities healthy and economically viable. Now, tonight we have representatives from Tri-County Health and your county commissioners who will talk about how we can safely stay safe, and reopen for business. Now, we know you have questions. In fact, we already have many lined up, and we'll get to those and as many as we can during this call. If your question is not answered tonight, you can visit douglas.co.us/Citizen Connect to submit your question, and we'll follow up with you. Now, as a reminder, if you've just joined us and you want to ask a question, you can press *3 on your phone, or you can send your question through the website. Let's get things started with a welcome from the Douglas County Commissioners. First, we'll hear from Board Chair Roger Partridge.
Welcome and thank you for joining us this evening. Tonight is the first of our weekly updates to the community on what is being done to safely reopen our economy under the COVID-19 Safer at Home orders. We know there are many questions you want to ask, and we will do our best to get to as many as possible during the next hour. Our goal is to share with you what we are doing with our local government partners, the business community, and Tri-County Health to help us safely reopen our economy.
Next up, Commissioner Laura Thomas.
Thank you, Roger. We're so glad you are all with us tonight. And once again, please accept our thanks for all you have already done to help put Douglas County in a position to reopen our economy. We'd also like to thank our Tri-County Health partners tonight on the call, Jennifer Ludwig and Melissa Sager. As Roger has said, we will do our best to answer your questions, but if we're not able to answer them, please go to our website, douglas.co.us/Citizen Connect, and get an email back from us. Thank you.
And finally, Commissioner Abe Layden.
Hello, everyone, and thank you, Laura and Roger. We certainly appreciate everyone on the call and your courage and determination that you're demonstrating today and every day as we walk through this crisis together. It's such an important priority for us to just sit with you, be transparent, open, authentic, answer your questions. Look, we work for you, not the other way around. So really looking forward to tonight as we work together to make a difference to help reopen our economy and stay safe.
Thank you all for those warm welcomes. And just a reminder, we're going to post a copy of this recording to our website in the next 24 hours. Now, if you're just joining us, to ask a question, you can press *3 on your phone or send your question through the website. Let's go ahead and get things started with an update from Jennifer Ludwig, Deputy Director of Tri-County Health Department. Ludwig? Hello, are you muted, Ms. Ludwig?
Excuse me, I forgot to unmute myself. I hope you can hear me now. Thank you all very much for joining this evening and for inviting us to come back to this telephone town hall and provide some updates and additional information for what it means to be in this safer at home phase. So Douglas County moved to safer at home last week, and many of our retailers went back to opening on May 1st, and many of our businesses came back to work on this Monday on the 4th. It still means, though, that we are still safer at home, and we need to stay at home as much as feasible while we gradually reopen businesses and start to slowly loosen restrictions. So COVID-19 is still circulating in the community and will probably be with us for some time to come. So we need to get used to what this new normal is. And the safer at home phase, it provides us with a more sustainable way to live our lives. And as part of safer at home, we still ask that you stay home if you are ill, and if you fall into a category of a vulnerable population, such as underlying health conditions or over the age of 65. So we still really want to protect our most vulnerable populations and safer at home while we can get out and do a little bit more than we did before. It's still really important that if you fall into a category of being a vulnerable individual, that you still stay home and avoid large groups. So while not required under safer at home, everyone is still strongly encouraged to wear a cloth face covering. It was mentioned earlier, and that is not required by the safer at home orders, nor is it required in Douglas County. It is being recommended as a good best practice in order to protect others. So the reason for this is you may be asymptomatic, meaning you might have COVID-19 and not have any symptoms. And so the cloth face covering adds some element of protection of potentially spreading the illness to others. So while out in public, especially in grocery stores, while you're shopping, and now when you go to get your hair cut, or some other establishments, they are being required, but there is no order in Douglas County. And some communities have issued orders. The city of Lone Tree, city of Denver, and now Boulder have issued public health orders that require a cloth face covering. Our Board of Health, who governs Tri-County Health Department, met today and has chosen not to direct Tri-County Health Department to issue an order to require cloth face coverings. We still support, however, local jurisdictions in taking local action, and we still strongly encourage the use of face coverings to add that extra layer of protection when you're out in public. Some other things that have been in the news or talk of the town lately are related to testing and contact tracing. So you may have heard a lot about contact tracing lately, and what does that mean? So as the state of Colorado has been able to obtain more tests and has a goal of eventually this summer of getting to the point where we can do 10,000 tests per day. We are not there yet, but that is the goal, to get there. And as testing increases, we expect that the number of cases will increase. And that doesn't mean necessarily that illness has increased. It just means that we're identifying those individuals who are positive. Because early on, if you remember, we said, if you think you have it, stay home, isolate yourself. We don't have enough tests. We are starting to get more and more tests. So there, you still have to meet certain criteria to get tested, but we are able to start testing more. So we will start to see more positive cases. Another public health measure that we do as part of testing is called contact tracing. And what that means is when a positive case is reported to the public health department, we call that positive case and do an investigation. And we will ask who you've been in contact with during a certain time period, probably before you became symptomatic, while you were symptomatic, and maybe right now. Who have you been in contact with? Then we will reach out to all of those people to let them know that they may have been exposed and that they need to monitor themselves for symptoms. And we will be continually to reach out to those individuals to make sure to find out if they've come down with symptoms, if they're doing well, and to keep track of how many people are out there. The reason why we do that, the purpose is to prevent people who may become ill, who might be asymptomatic, from exposing others. So we are ramping up our ability to do contact tracing, anticipating that we will get more positive cases only because we're doing more testing. So it's a couple of public health measures that we are doing as part of the Safer at Home phase. If you would like more information about testing, there are many places in Douglas County that are still doing testing, and there are sites throughout the state. So you can visit our website, which is tchd.org, and look for the Testing Sites, Isolation, and Home Care tab. And that will get you some information about where you might be able to get testing and what criteria you need to meet in order to be tested. And as well, you can go to the Colorado Department of Public Health and Environment's website, and they have some testing information there too. So I think I'll pause because I'm sure that we have a lot of questions.
Thank you very much. Yes, there are a number of people with questions in the queue. So let's go ahead and jump out to Castle Rock right now. We've got Melissa on the line. Melissa, what is your question?
Yes, hello. Are there any updates on when churches will be allowed to reopen?
Good question. Melissa, would you like to answer Melissa's question?
Sure, absolutely. It's a great question. Churches are actually defined as essential under both the stay-at-home and safer-at-home orders. They are allowed to operate with groups of 10 people, and that's the standard number that we ask for groups to stay under. We're still encouraging churches to operate through virtual services or unique settings like drive-in services, as they've been doing over the last 6 weeks. We ask them, as well as all of our businesses, to operate that way for as long as possible until we have more data to show that it's safe to congregate in larger groups.
Thank you very much for that answer. Let's go off to Lone Tree. We've got Vaughn on the line. Vaughn, what is your question?
Hi. Thank you very much, Francine. Thank you for also considering not using masks. There's lots of medical articles saying that they're not useful. I ran an emergency room in the Children's Hospital in Melbourne many years ago. I'm worried about the stay-at-home causing an uptick in domestic violence, failure to present with treatable conditions, potential suicide. Is there somebody monitoring the down effects of what's happening here, the downside?
Who on the line can field this question for Vaughn?
So this is Commissioner Thomas. I'm happy to answer that.
So is
Yes,
anybody in the...
Commissioner, you were going to answer the question?
Okay, thank you. That's certainly, Vaughn, that's a great question because we've heard from several people, is the cure worse than the disease? And I want to tell you that we certainly have been watching for suicides, for domestic violence, child abuse, as a result of people being home for so many weeks on end. I will add that I did some research with the CDC, the Centers for Disease Control and Prevention, from 2004 to 2010. That was during the recession of 2008. And absolutely, there was an uptick in suicides from people who lost their homes. So we're very aware of that. And that's why the county has put more availability into mental health services. So if you are at home and struggling, please call the county, because we have community response teams that are available to help you get the help you need. So Vaughn, thank you for that question. And yes, that's something that we are all very aware of.
Thank you very much for stepping in on that. We've got a question now from the web. Someone listening to this call on the World Wide Web. It's from Angie. She wonders, is there a definite date for restaurants when they can open? And will there be social distancing, tables 6 feet apart? Will there be a percentage of a max capacity limitation? An example of perhaps 25% of the total capacity of the restaurant at that time.
This is Melissa. There is not a set date for restaurants right now. We are waiting for additional data to come in to indicate how the Safer at Home is going. Douglas County was just eased into the Safer at Home just this past week. And so we're looking for additional data to see how that's going, to see how opening up gradually is going before we start opening areas that may be a bit more risky, like restaurants. We do anticipate when restaurants open that they will have social distancing measures as you described, maybe 50% capacity, so every other table. Maybe your server will be wearing a mask, maybe you'll be wearing a mask. So those are active conversations that are happening both at the local level and the state level, and we're exploring different options to open those businesses safely.
Thank you very much for fielding that question. And as a reminder, if you're on this call and would like to ask a question, all you need to do is press *3 on your phone, or you can submit a question through the website. We will post a copy of this recording to our website in the next 24 hours. All you need to do is visit douglascovid19.org for county-specific COVID information provided by partners throughout the county. We've also got another online question now for one of the commissioners. And the question is, I'm a contractor with the county opening some services. Am I now able to get inspections done? And can I visit the building department if I need to? Commissioner Partridge.
Thank you. And yes, as you may know, we have continued to provide many services virtually, online, via phone, and other means during the stay-at-home order, as this week began the reopening phase. Today, our Building Services Division resumed inspections inside homes for some purposes allowed by the Safer at Home order, and our field staff is also following guidance provided to do safely for both the staff and the public. We're also continuing some video inspections as necessary. And our building division reception desk in the Philip S. Miller building is also open during regular business hours, and we can serve 2 individuals at a time with proper distancing and safety in place. We are still encouraging citizens to use the online services, our lobby pickup and lobby drop-off options for permits, though. Thank you.
Thank you very much, Commissioner. Got another question here. I'm a business owner and I've been having trouble finding the protective equipment I need to be able to open my business while still following these guidelines. What should I do? Let's go ahead and toss this one to Commissioner Layden.
Yes, thank you so much. So some really good news. And, we realize we're dealing with this dual crisis, both containing COVID-19 and then making sure that the economic fallout is being addressed and that our business community and our citizens are being cared for. But a lot of good news. Thankfully, our community partners, our county, our staff, my fellow commissioners have been working very hard on this. But in terms of PPE, in terms of what we've filled to date, we have 15,110 N95 masks, 142,284 surgical masks, 3,333 face shields, 8,223 gowns, and then we have 124,050 gloves. So the PPE is coming in. We're continuing to see those orders get filled from a county perspective. And just to add, we also received information in terms of the medical need with hospital beds. Right now, we do not have an ICU bed shortage at all. So all of that has been addressed. We've certainly, due to the wonderful work of Douglas County citizens, been able to flatten that curve and ensure that we're not seeing that surge for healthcare workers. So we're seeing that for healthcare workers and certainly more PPE for the business community.
Thank you very much for that information. Another question, Commissioner Thomas, this one's for you. Can I modify my facility or building to accommodate social distancing requirements or other COVID-19 safety measures? Commissioner Thomas, are you muted? Hello, Commissioner Thomas. All right. Commissioner Layden, do you have any input here on the question of can I modify my facility or building to accommodate social distancing requirements or other COVID-19 safety measures?
Yes, and so as my fellow commissioners are calling back in, I realize we're having some tech issues, but yes, absolutely. The Board of County Commissioners has been having some pretty significant discussions about opportunities for businesses to make modifications that are necessary in light of COVID-19. And so certainly, whether it comes to ventilation or changes in landscaping and certain perimeter issues to accommodate that 6 feet of distance, the county is working hard to make sure that the businesses are accommodated on that level.
Thank you very much for taking that question and answering it so well. Since we've got you, I've got another question here that I think you're well positioned to answer. And the question is, I heard a while ago that our local food banks needed more food. Is that still true?
Yes, it is absolutely true. We saw an increase of 400% in terms of need at our local food banks. Thankfully, so many citizens and businesses have stepped up to provide our food banks with necessary resources. The county has provided $50,000 to ensure that food banks have what they need, but they still could use more. And certainly there's an ongoing need there. So there is the COVID-19 Recovery Fund that was established by the separate Douglas County Community Foundation, or you can give directly to your local food banks.
Thank you very much, Commissioner. And as a note to everybody on this call, we're about halfway through this telephone town hall discussion about safely reopening. And we'd like to hear from Tri-County Health about what we can all do personally as we safely reopen our economy. So let's see here if I can get Melissa with Tri-County Health to give us a couple of ideas and key points.
Absolutely. So really, it's the things that we've been doing over the last 6 weeks. It's nothing new. It's masking, it's social distancing, it's staying home, especially when you're sick, and isolating if you're sick. Tri-County is working on a public health information campaign, and it is geared at getting people to follow these social distancing requirements. Again, those same ones that you've been doing for the last 6 weeks. We think that we can educate the community about what the requirements are. Tri-County is actively putting together guidance for our businesses and the general public about what practically they can be doing in different situations. And we'll be working to get that out through social media, newsletters, radio, and you can also check out the website under Partner Communications. We have some of this campaign that you're seeing on your screen now on the website, and you can take a look around at what some of that other messaging looks like.
Perfect. Thank you very much for that input. So if it's all right with everyone on the call, we're going to take another couple of questions. We've got a number of folks in the queue, and I've got James on the line from Parker. And James, go ahead with your question, please.
Okay, my questions are threefold. I have three different questions, and I want to ask them all, and then respective agencies respond to those accordingly. Number one is last week, Denver Post, Douglas County posted a 19% increase in COVID-19 cases, new patients infected. Number two, a 21% increase in death rate associated with people already infected. So my question is, are we moving too soon, too fast in opening up restaurants and other places of business based on a recent uptick in those rates? That's question one. Number two, the masks that I have been trying to order online through various agencies have been harder to get, or 3, 4, 5, 6 weeks out. The ones I can get locally are very low quality. Is there anything that Douglas County can provide that gives us greater direction on getting a better quality of mask versus the cheap things I've been seeing on the internet? And then my last question is on the restaurants reopening. Recently, we were out last week to a restaurant that had told us that they were reopening on Tuesday, which was ahead of the conference call we had 2 weeks ago that said what the status within Tri-County on opening restaurants for dining in was going to be. So is there an official policy? And I know we heard earlier that restaurants are going to be reopening with a 50% capacity and social distancing, but is that in Tri-County and specifically in Parker, is it the same throughout all? Thank you.
Okay, James, thank you very much. Let's see if we can break this apart. So for the first portion of this, Jennifer, can you talk about the idea, are we moving too fast in reopening? Is that something you can speak to?
I will speak to that, and thank you. And thank you, James, for the question. I did not see the article that you're referring to that stated that we had an increase of cases and an increase in death rate in Douglas County. We have been tracking and following all of our data in the 3 counties that we serve, which is Adams, Arapahoe, and Douglas counties. You may be aware that when the governor announced moving to safer at home, we worked with Douglas County to ensure that Douglas County was ready to move into that safer at home phase. The governor did give local public health agencies the authority to, and local municipalities, to adopt stricter orders than the safer at home. We felt, looking at the data, because the data had continued to decline in Douglas County concerning the rates. So the number of people infected per the number of people who live in Douglas County is significantly lower than other parts of the metro area. So we've been following very closely Douglas County's data and felt confident in Douglas County moving into safer at home. Safer at home is a gradual reopening, so it isn't everything opening at once. Businesses can only come back at 50%. Personal services such as a hair salon, hair studio, can only have up to 10 people max in their facility. So it's a gradual reopening. As you may know, if you've been out grocery shopping, they are monitoring and measuring how many people can be in the store at any given time to limit the number of social interactions that we have. So safer at home is a very gradual reopening of our economy, which is really critical to get our residents back to work and get our businesses back going again. Adams and Arapahoe County, on the other hand, the numbers there were increasing, and we were very concerned about a few hot spots in those counties. So we worked with leadership in the cities and the county and extended the stay-at-home order for those 2 counties because the numbers were not showing that they were in a place to open safely. Those 2 counties will be slowly reopening and joining safer at home this coming weekend when the order expires. So I do feel, and while I can't speak to the article that you read, so I don't know where those numbers came from, but we watch the numbers daily. And they go up and down as testing becomes available and as cases are reported to us. So it is hard to watch just on a daily basis. But as we watch the trends, we feel and felt that Douglas County was in a good position, and that the numbers indicated that we as Douglas County residents are ready to move into the safer at home, where we have been for about a week. We will be closely monitoring to make sure that we don't have a huge uptick. And what we would be watching would be the number of people hospitalized and the number of people going into intensive care units. We have not seen that in a while in Douglas County, and we've not seen that over this week. So as long as we all do our part and live within the confines of the safer at home order, wear masks when feasible, staying at home when feasible, and continuing the good habits that we've been building up over the last 6 weeks, as Melissa was talking about, then we'll continue to see improvements, and we'll be able to start gradually opening more. Regarding the restaurant reopening, restaurants are not allowed to reopen under safer at home anywhere in the county. There is one variance in Mesa County that allows restaurants to open partially. For Douglas County, restaurants throughout the county can still only do takeout, delivery, and curbside. So there should be no in-room dining for any restaurants throughout Douglas County. We don't know when restaurants will be reopening, and I know, there are task forces that are looking at that, and we hope to be able to start working with the restaurant industry to think about what safe reopening looks like, and what does it mean to have 30 or 50% open, and what safety precautions need to take place. But currently, under safer at home, restaurants cannot be open. I think I'll stop there.
Let me add too, just from a specific number and maybe a website standpoint. James, thanks again for the question. But first, I wanted to let you know that Energize Colorado has established an online marketplace for PPE and other supplies for businesses and nonprofits. And that's https://energizecolorado.com/get supplies. So again, it's energizecolorado.com/get supplies to get more of that PPE. And just to give you the specific numbers, I really appreciate Tri-County's comments and certainly what Jennifer informed us all of. But specifically in Douglas County, we've had 608 cases. Adams County has had 1,805. Arapahoe County has had 2,800. So Douglas County is really in a much, I think, healthier position just from a number standpoint. And when it comes to deaths, Arapahoe County has had 138. We have had 25 deaths. So we're really looking at a percentage of a percentage when you consider that the three of us represent 370,000 people. The drawback and the thing to really think about is that as of today, we're looking at 30 million jobless claims across the country. So as we look at this crisis, we really have to examine it as a dual crisis and make sure we're being thoughtful about the economy. I'm sure my colleagues have a little bit more to share on that level.
All right. I didn't hear anyone else jumping in. I do have one more question that kind of dovetails into what we've been discussing. And this question comes from Kim down in Franktown. Go ahead, Kim, with your question, please.
Yeah, good evening. I'd like to direct this question to Jennifer. So the national standards for opening at this point for gyms is that gyms should be open. The state guidelines have defined gyms as fitness businesses of all types. Yet the state guidelines allow fitness facilities in institutions and households to be institutions in hotels and so on to be open. Yet the state guidelines allow personal training, but don't define where that personal training should take place. I'm wondering what Tri-County Health is doing to rationalize the process to allow fitness businesses to reopen, and recognizing that not all gyms are created equal, and small appointment-only facilities can provide safe social distancing under highly controlled positions. So what are we doing to figure out the standards for reopening fitness businesses in Douglas County?
Thank you, Kim, for that question. And this is one we have been getting ever since the Safer at Home orders came out, relevant to gyms and pools. There are a lot of people wanting to know what's going to happen with pools this summer, and how is personal training different than a gym. The concern with opening gyms is the shared equipment and and a lot of gathering, the potential of a lot of people gathering. We continue to ask the experts at the Colorado Department of Public Health and Environment for continued clarity on the public health orders specific to recreation gyms, because there are a lot of things that are contained in the definition of a gym. And you're right, not all gyms are created equal. And personal training, as you probably know, is allowed under the Safer at Home orders, but it can be up to 4 people. So part of some of our recommendations and what we've been advising others, depending on what type of facility, is what we're looking for is if you have appointments. So if you're doing personal training, it's typically with people who have an appointment, and it might be mixed individuals or family up to 4, where you're providing personal training, where you can maintain social distancing. You're not sharing equipment unless they're family members of a single household and they can share the equipment. What we're wanting to avoid is just walk-in, lots of people congregating, sharing equipment where they could be sharing germs and potential sharing the virus if anybody were symptomatic or asymptomatic. We don't know what the next phase after Safer at Home, when gyms in full will be able to open. But if you are operating a small gym or a facility in which you are offering services by appointment, and you can do that in groups of no more than 4 people, then that would meet the criteria of the Safer at Home order. And I don't know if Melissa can add any more to that.
This is Melissa. I think that was very well put, that personal training can happen in gyms in those small groups of 4. And we are working with the state to look at what expanding operations within the gym setting will look like, again, just given the riskiness of spread of COVID in these settings. So, but yes, those facilities can be used by appointment only for small group personal training.
Dirk, this is Commissioner
Melissa,
Thomas. Could I weigh in on this one, please?
Most definitely, yes.
Yeah, I would just like to add that Kim has a facility in Highlands Ranch, and he and I have been emailing constantly with each other for 2 weeks. And this is one that we are working with Tri-County Health, that he can do a facility with an instructor and 9 people, and they won't share equipment, and they can do social distancing. And this is an example of one that I'm hoping we can use a variance on and work with Tri-County to get done, because he has demonstrated to us through his emails that he can do all of the things that you're requiring, only he can do it with 9 guests instead of 4.
Thanks, Commissioner. Would be happy to chat with you about that offline.
Thank you.
All right, and if I could get Melissa to go ahead and also drill down on a few other places and things that are on people's minds, like pools and youth sports, etc. Would you mind talking about that in this kind of new world that we're living in as we try and reopen and get back and resume some normal activities?
Not at all. Thank you. The pool question is a good one. Jennifer mentioned it. We have gotten this one a lot. When can pools open? You know that summer is coming. It's an outdoor activity that people like to engage in. Pool facilities are inherently more risky than a traditional business setting or office setting where people social distance naturally. And so we're, again, in the same way that we're looking at gyms, how do we open these facilities safely in a way that allows for social distancing? It's very different in the same way that everything looks different now. And we're just trying to figure out what that different needs to look like to keep businesses operating to the maximum extent while also keeping folks safe, both employees and consumers. And I'm sorry, it was pools? Team sports, another, yes. So we're getting that a lot. Youth sports, again, inherently risky. There's close contact sports like soccer, sports like baseball, you're touching the same ball even. And so that shared equipment, that shared proximity is risky. And especially when we're talking about children engaging in these activities, we want to make sure that we're doing them as safely as possible. So currently, any activities with a coach would be personal training, can be done in those small groups of 4. We are looking at what it looks like to expand that as well. So what it looks like to keep kiddos safe while letting them engage in these outdoor activities that we know are good for them. So we are working with the state. We're waiting for additional guidance on those activities, and we will keep folks informed. We encourage you to check out the state's website, but also Tri-Counties and reach out. The best way to get updates often is through our call center. So if you haven't given the call center a call, the number is 303-220-9200. And we can often find quick answers or connect you to someone who can and often provide those quick updates. So if we have an update on team sports and you're calling, we can make sure we can connect you with that.
Thank you very much for that answer. And everyone on the call, we certainly want to make sure you stay informed about what's happening in Douglas County. If you'd like to continue receiving information from the county, please press 1 on your telephone keypad now. Again, just make sure you stay informed about what's happening here in Doug County. Please press 1 on your phone now. All right. So moving forward here, I've got just a couple more questions. These are rather interesting. Someone wonders, will farmers markets be able to open this summer? Seems like a great question for Tri-County Health.
Farmers markets are actually allowed to open currently. So we have guidance on our website. We also have guidance by the Farmers Market Association. Again, that access to fresh fruits and vegetables being the reasoning behind that. Oftentimes we do see farmers markets that operate in conjunction with other retailers and vendors. We are talking about what that looks like. As of now, that activity is too risky in a enclosed area. So this is an active conversation that we have been talking about over the last few days, and we'll issue updates when they become available.
Thank you for that clarification. Now, Commissioner Thomas, we'd love to hear a bit more from you about how Douglas County has been partnering with others in the community to get the economy moving again.
Thank you, Dirk. Douglas County has a long history of being successful because we partner so well. We have had ongoing quarterly meetings with all of our municipalities. And once we went into the stay at home, we started having weekly phone calls on Wednesdays with all the mayors, the Highlands Ranch Metro District, the libraries, the school district, because we know when we communicate, we do a better job. So we've been continuing to do that. I think one of the most important things that I'd like to talk about is the variance process. There is an opportunity to work with Tri-County Health and then move on up to the state health department. When we feel that we have somebody who right now appears to not be able to go back to business, but we feel that they have got a plan in place that will keep everybody safe. And one example is what we're doing with Park Meadows Mall right now. I'd like to really thank Jennifer Ludwig at Tri-County Health. She has been phenomenal in working with Pam Kelly at Park Meadows Mall. Pam, I'm just absolutely blown away at all of the things that Pam has thought of and has implemented in her plans to get Park Meadows open. So our staff has been working with a suppression plan. We are getting letters from the hospital saying that they do have capacity and they do support us continuing to open up more things. So by the end of the week, we'll be submitting a letter to Tri-County Health and then onto the State Health Department, asking to please allow Park Meadows to open. And once we get that done, we will be doing that with other businesses. We've got churches working on plans now on how they can open with social distancing in place and plans to keep their guests safe. So I just want to let everybody know that we're as frustrated as you are, that I want to go out to a restaurant. And we have a process in place to work with Tri-County Health to get these variances done so we can continue to move forward with our county. We've been meeting with different business leaders, different phone calls, hearing from them about what ideas they have to keep their customers safe. I just want everyone to know that I see a lot of great things going on in the future for Douglas County residents. Thank you, Dirk.
Thank you very much, Commissioner. Next, we've got a question from Highlands Ranch. Jason, you're live on the call. What is your question?
Hi, yes, thank you all for your service and for answering our questions. Really appreciate you being there with us and for us. I have a question about visiting our families at care homes. I understand that they're a very sensitive population and at risk themselves, as well as being able to being in a position to likely be highly contagious. But I'll tell you, the folks that are in memory care and assisted living are also very limited in their resources to be able to stay healthy. And taking away visits, most of these homes have been locked down for 2 months or more now. And trying to see when will we be able to visit our families again in a controlled environment, like in any other area, going to a grocery store, possibly going to a restaurant with social distancing. Maybe we can go to these assisted living and memory care places with gloves on and masks on while being directed straight to someone's room for a 15-minute visit under an extremely controlled environment. Just curious if you have any feedback or thoughts on when we might be able to start visiting them and how that might look. Thank you.
Jason, thank you for your question. Melissa, would you like to take a stab at the answer, please?
Sure. These, as you know, these facilities have been very prone to outbreaks, hence the additional caution in visitation to these facilities. One of the huge barriers to allowing folks access in the way that you described is access to PPE, that personal protective equipment. So we don't have enough PPE to make sure all of our medical professionals have them. It's something that we've asked even dental offices, for instance, not to do non-urgent procedures because there's a shortage of PPE to keep folks safe. So to allow visitors into the facility, that PPE just isn't available. And that's the kind of protection that we do need in place to allow visitation because the risk is so high. So it's this balance of what's available to keep these facilities as safe as possible for these residents because of the close proximity that folks live in there. It's just so risky for COVID-19 to spread throughout.
Thank you very much. And since we've got you here right now, Melissa, I've got a question that was submitted. I've been putting off my yearly health screenings and preventative appointments. Is it safe to do that?
Yeah, so we did ask folks to put off those regularly scheduled procedures under the stay-at-home order. The state has relaxed that a bit to allow access to these regular procedures. We ask that you call your provider about that question. Can you wait a bit longer? If you can, That's the goal. Again, just keeping as many people home as possible, having folks only leave when absolutely necessary. If the time frame has been a while for you and that the need is increased, your provider would let you know that, and those procedures are allowed.
Perfect. Thank you very much for that clarification. And Commissioner Thomas, earlier we went with a question to you, but you had dropped off the line momentarily. And I would like to come back around and get your insights on this. So the question for you, Commissioner, can I modify my facility or building to accommodate social distancing requirements or other COVID-19 safety measures?
The Board of County Commissioners next week on May 12th are going to have a question on our agenda to streamline the process so that you can get these changes done more quickly. And what I'm talking about is, say you have a restaurant with a large parking lot and you can't fill up your restaurant because you have to have so much space between your tables, so you can't use your whole parking lot. There will be an opportunity for you to temporarily make your parking lot into a patio area if you choose. And we're going to streamline the processes so you're not going to have to go through a planning commission and a commissioner meeting, that the director of our planning department can make that approval for you on a temporary basis. The commissioners here are very dedicated for doing whatever we can to help the businesses get up and running, because we can't even imagine what you have all been dealing with. So if you have a question about a change in your facility, don't be shy, call us and we'll figure out a way to make it happen.
Thank you very much, Commissioner. So just as a reminder, we will post a copy of this recording to our website in the next 24 hours. Visit douglascovid19.org for county-specific COVID information provided by partners throughout the county. So we've got, let's see, your time for just a few more questions. We definitely want to thank Jennifer and Melissa, as well as commissioners and everyone who joined us tonight to listen in. But let's go to Blonde in Lone Tree. Your question is what?
Hi.
Hello,
yes.
Blonde. Are you there?
Hi. Yeah. So I was wondering when libraries and art museums will open back up.
Yeah, absolutely. I'll take that. We are allowing, under the Safer at Home order, libraries are allowed to operate through curbside. So the same way we saw traditional retailers operating with books and returns, and they have a sanitation process in place for those returns at a later date. Museums, other places of entertainment, including libraries, are a bit more risky because people linger, they touch things, they use the restroom, they sit down. In a library, they may use a computer, they may touch a few books and put them back. And so we're looking at, again, with these other unique businesses, like some of that activity earlier, what are the unique things put in place to allow these facilities to operate to the greatest extent possible while also keeping folks safe. And it's just going to look very different. And we're still talking about what that different will look like.
Thank you very much for that answer. And we do thank everyone.
Dirk, may I add a question, some information about libraries, please?
Most definitely, Commissioner, yes.
Dirk, I'm just going to go ahead and talk. So the director of the libraries is on our weekly phone call, and they are going to open next week for curbside delivery. So if the gentleman in Lone Tree is waiting to get a book, you can go online and reserve that book. They already have over 1,000 reservations. But go ahead, reserve that book, and when your time comes up, they will deliver the book out to you. And then when you turn the books back in, they're going to quarantine those books for 72 hours or whatever item it is that you use, so that they have time for that virus. It can only live, we understand, for up to 72 hours. So those items will all be quarantined and then put back into circulation.
Thank you very much for that additional information about libraries. And as I was just mentioning, we appreciate everyone for making the time to join this telephone town hall. As a reminder, if your question wasn't answered by us tonight, we encourage you to visit the Tri-County Health website at www.tri-countyhealth.org. or the state's site.
Well, it sounds like we might have lost our moderator. I'm not sure if any other the host can hear Dirk, and nobody else is able to hear Dirk. And we are just about ready to wrap up. It's roughly 6:30. We apologize that we have lost Dirk. I'm hearing a voice in the background. I hope that's not him. But before we leave, we'd like to give the commissioners, Laura Thomas, Commissioner Abe Layden, and certainly Melissa and Jennifer a chance to have some closing comments. Commissioner Thomas.
Thank you, Roger. I want people to think about the things they've heard tonight, that there's a lot of innovation going on. That's what capitalism is all about, and people are figuring out how they can continue to deliver services in a safe manner. And if you have a question that you didn't get answered tonight, please go to our website, to our Citizen Connect page, answer the question, and we have been answering all of those emails. Maybe not immediately, but we're getting to all of them. So please continue to stay engaged with us. Thank you, Commissioner Partridge.
I'm going to go to Jennifer and then Melissa.
Great. Thank you very much. And we just really appreciate all of the questions that have come in and continue to come in. And Melissa gave our call center number, but I'll give it one more time. It's 303-220-9200. We really ask if you have any questions at all to call in. If you're a business owner, if you're a resident and you're just wondering, what does Safer at Home mean? How can I open? Am I doing this right? Can you explain something in the order? We are here to help and make sure that our businesses get open in a safe manner, that we are able to protect our public's health, but that we can also get our retailers back in business and allow us to be out and about in a more sustainable manner. So thank you for joining tonight, and we look forward to communicating with you in the future.